This is Say's recording. This is my first time actually recording anything.
Yes, you are all good at recording.
Well, thank you all for coming to the Mental Health Town Hall tonight. We have 6 wonderful panelists here tonight, and I'll introduce them. So the way tonight will go is that we have a TERPS form that I'll put in the chat right now. So if any of the participants want to ask a question, you can do it anonymously through that Google form link. You can also raise your hand to ask a question if you feel comfortable doing that. So as for our panelists, our first panelist is Micah Herman. Micah, she, her pronouns, is a senior psychology and English major and the president of the Help Center, which is UMD's peer counseling and crisis intervention hotline. Our second panelist is Kelly Sherman. Kelly, she, her, is a senior public health science major from New Jersey. She serves as the vice president for the Student Health Advisory Committee. Throughout this role, she advocates for TERPs at the University Health Center. Additionally, she is the health and safety chair for a sorority. Kelly loves the public health field due to its evolving nature and learning how the social determinants of health play a role in determining one's health. Our third panelist is Dean Boris Lushniak. Dean Lushniak, is the current dean of the School of Public Health, starting this role in 2017. Before coming to UMD, he served as professor and chair of the Department of Preventative Medicine and Biostatistics and professor of dermatology. F. Edward Herert School of Medicine at the Uniformed Service University of the Health Sciences in Bethesda. Dr. Lushniak was the U.S. Deputy Surgeon General from November 2010 to September 2015, assisting the Surgeon General in articulating the best available scientific information to the public to improve personal health and the health of the nation. He also oversaw the operations of the U.S. Public Health Service Commission Corps, comprised of approximately 6,700 uniformed health officers who serve in locations around the world to promote, protect, and advance the health and safety of our nation. Our fourth panelist is Dr. Tracy Ziegler from the School of Public Health. Dr. Tracy Ziegler is the Director of Undergraduate Studies for the Department of Behavioral and Community Health in the School of Public Health. Dr. Ziegler began her work at the university 15 years ago as the coordinator of wellness programs for the University Health Center. She developed and implemented health education programs focused on exercise, nutrition, and stress management for students, faculty, and staff. Dr. Ziegler transitioned to the academic side of the university in 2011, teaching and advising for the Department of Behavioral and Community Health. In addition to her departmental role, Dr. Ziegler is the faculty advisor of Eta Sigma Gamma and the American Medical Women's Association and serves on the board of directors for the National Case Study Competition in Health Education. Her research interests include exercise uptake among older adolescents and young adults, and the educational outcomes and professional readiness of the students she serves. Our next panelist is Dr. I'm sorry if I pronounced it right, Chetan Joshi. Dr. Joshi started as the director of the UMD's Counseling Center in January 2020. However, Dr. Joshi is no stranger to the University of Maryland. From 2008 to 2009, he completed a mandatory 1-year internship at UMD's Counseling Center as part of his doctoral studies. Before his appointment at UMD in January of this year, Dr. Joshi served as the associate director and then the interim director for the University of Connecticut's Counseling and Mental Health Services for 7 years. Before that, he was a staff psychologist and the coordinator of disability services at Franklin and Marshall College in Lancaster, Pennsylvania for 4 years. Dr. Joshi is a pharmacist by training and has a master's in neuropharmacology and a PhD in counseling psychology. He is originally from India, came to the US as an international graduate student. Dr. Joshi's areas of interest and work have focused on multiculturalism, meaning-centered therapy, holistic approaches to well-being, international student mental health, spirituality, and social justice. Our last panelist is Dr. Adam, could you tell me how to pronounce your name?
Yep, it's Unizai.
Okay. Dr. Adam Unizai is currently the assistant director for the University Health Center in Behavioral Health. He started this position on March 9th, just as the pandemic began, and changed how we all work here at Maryland. Before that, he had not been in any way affiliated with the UMD system. Instead, he came to the University Health Center from the Adventist healthcare system. He served as the medical director of behavioral health services for Washington Adventist Hospital, now White Oak Medical Center. Before his 6 years in the Adventist system, he served as the medical director of the inpatient psychiatric unit at the DC, Virginia Medical Center. Prior to his experience there, he completed his internship and residency programs at Georgetown University Hospital. Originally from Minnesota, he calls Bethesda, Maryland home and has two 11-year-old daughters in the 6th grade. Before starting a career in the medical field, he had been on track to obtain a PhD in clinical psychology and indeed completed a master's program in psychology at American University here in DC before he decided to pursue medicine. He attended an osteopathic medical school in Pomona, California, and then chose psychiatry as an area of focus. Dr. Yunusai has a keen interest in the topic of burnout and has done work on this both with physicians in hospital system settings and various private practice settings. He is now applying his knowledge of burnout to help tackle it here in the world of higher education. These are our wonderful panelists tonight, and just for the panelists and also for the participants, if you could put your pronouns and your names, and we'll get started. So I guess the first question we can start off with is, what are the common mental health problems college students face? And anyone can start.
I'll start. And my dad taught me a way to say our last name, which is and then you take a sigh because so Yunusai. Now you'll never forget it. I mean, when I saw this question, I thought, college age students are really kind of subject to the same mental health issues that we all are. Having said that, in this age group, at least, some things come to my mind, including things like substance use, for example. Also, at this age group, for men at least, often things like schizophrenia can first show up. So I think, we're all human and we all have the same issues, particularly this population. There are just a few things that kind of stick out in my mind. I think I wrote one other thing down. But yeah, that's pretty much what I will start kind of by saying. Other people might have other things.
So I can certainly add to what Adam said. So at the counseling center, when we have students come in for treatment, we have them take this instrument called as CAPS, where they're able to kind of rate what are their presenting concerns, and the clinicians also able to rate what the primary presenting concerns were at the time of their initial appointment. For the last, from about 2005 to 2009, there were the top 3 presenting concerns consistently in the order were depression, anxiety, and academic issues at the counseling center. Then something changed, and starting from 2010 onwards up until now, instead of depression, anxiety, the order went to anxiety as the topmost presenting concern, then depression, and then academic issues. And then you have all of the other issues that Adam mentioned, plus a few. I'm just noting the top 3. So that was happening up until COVID-19 hit. And then once COVID-19 has hit, what we have found is that the top 3 presenting concerns have actually changed. What they have become is anxiety, depression, family issues, and then academic issues. And I think this makes sense because a lot of our students are now living in their family environment. And this, while the family environment can be an incredibly supportive environment, obviously that also comes with its own challenges. So that is what we have seen so far.
Mute myself here. And I'm not a behavioral scientist by any means. I'm trained as a physician, initially as a family physician, as a dermatologist, as a preventive medicine person. I see myself as a public health practitioner. But both Adam and Shetan have just said is what we see from the academic sense, and I'd like Tracy to sort of opine shortly, is that, what we see is a population of young adults, right, going through a metamorphosis, right? When especially at the undergraduate level, the metamorphosis goes from what? From being a high schooler to 4, 5, 6 years later being an adult. And oftentimes you come in thinking you're fully an adult, but there's, I sometimes question at my age whether I'm fully an adult, right? I mean, we always think of ourselves of always being in a period of growth. And I think the reality of the situation is it's become a generational thing. And I think your generation in particular, speaking with the younger people here, the issue of stress and anxiety, which is, the pressures upon you to have it all figured out, right? What are you going to be? What are you going to do? How are you going to make a living? How are you going to pay for this? What is the plan becomes an overwhelming part of the academic environment. And then you throw in the curveballs, right? You throw in something from completely out of the ordinary, such as COVID-19, such as racism discussions, such things as the murder of George Floyd, climate change, and all of a sudden we've set up this formula, this concoction that now, it's stress, and stress perhaps, as we would say, on steroids almost, because of all the uncertainty of the unknown. Tracy, what do you think?
I agree with that wholeheartedly, and with the previous panelists as well. Being in the classroom and working with our students almost every day, I am seeing these levels of stress and anxiety just skyrocketing, especially since COVID, and as Dean Lushniak was talking about, the murder of George Floyd and the election as it is upon us here in less than a week. And I am getting notes on the regular from our students, I can't cope today. I'm not sure I'm going to be able to get my work done today. And so it's really come to a forefront with all of this and shifted how we all have to think about these issues as well in higher education and how we work with our students. I think from the academic side, it has taught us all to be so much more compassionate and to be ready to help students navigate through these issues. And I will say that these levels of anxiety are just unprecedented, nothing I ever imagined. Thinking back to my first years on campus, working as a health educator in the health center, these were not the issues we were dealing with. It was depression. I dealt with a lot of students coping with eating disorders. Things have shifted tremendously, and we can see that in our services that are being offered as well.
Just to add off of that and speak from a student perspective, I am a student, I'm a senior, and I've seen a lot of my friends and just people in SHAC really concerned with different stressors about college, but also most importantly, like with COVID, there are lots of stressors with hanging out with people and, oh, what are you supposed to do in certain situations? And then certain individuals will not hang out with people because their friends might not be acting so safe, and that can lead to different isolation and things for students, which is really hard to cope with and just go through your daily life, like not having those social interactions that we're so used to having on our campus. So I'm not sure if Micah wants to add anything about the student perspective.
Yeah, I mean, I would just echo that coronavirus is presenting a lot of unique challenges and very unique forms of isolation, as Kelly mentioned, which I think can exacerbate all of the other mental health issues that the other panelists addressed, including depression, anxiety, and academic concerns.
And going off of that, when would you recommend that students seek out professional help?
Yeah, I'll start with that one. Because I think I will, distinguish between, when you should and when maybe you want to. I think because oftentimes, well, I think the general rule of thumb that I think of, and other panelists can chime in, is when it really starts to impact your daily functioning, like your ability to kind of go through life as you normally otherwise would. But I also think, and that's when you definitely need to. But I also want to put a plug in for the benefits of doing so, even if you're not at that point. You really, sometimes we don't know what we don't know, and we don't know how psychotherapy, talking to someone, learning about different things can help until we actually do it. And so I think the stigma is decreasing. There have been some studies about that recently, and I think that might allow people to kind of, get to the comfort level of, seeking out some kind of therapy or other. But so I just want to make that distinction. I think it's probably more clear, the functioning part when you need it, maybe less clear when it might be useful for you.
And I 100% agree with what Adam said. I think the only thing that I would like to add is, if you are in a situation where you are questioning whether you feel like you need to get support or not, what I would recommend is just go ahead and pick up the phone and call us, and we'll walk you through it to figure out if this is something that you need to do or not, or where you're at, right? So don't sit with that question, act on it, call us, and we'll help you figure it out.
And I'm going to put in from my perspective, and Kelly and Tracy have heard this a million times at the School of Public Health. I'll start with the basics, right? What is health? And I always go back to the concept that the World Health Organization has put out there. Health is complete. Listen to this, everybody on board. And if you like, close your eyes as I say this, because I think you need to hear this. What is health? Health is complete, physical, mental, and social well-being, and not merely the absence of disease or infirmity. So let's take that. Complete, it's aspirational. Am I going to be fully healthy in all those three realms? The answer is it's aspirational. My hope is that we have a healthy society and that I as a person am healthy, right? Taking into account that. Your question, Daniel, is sort of based on almost a premise of, okay, let's start with the physical aspects of this. When do you go see a doctor for a physical malady? That's kind of tough to say. Some people will tough it out. Oh, my leg's been hurting for a while, or I've had this headache or whatever. There's really no set parameter, even on the physical side, to say now's time. You almost know it when what? When we're overwhelmed with pain, when we're bleeding, when there's something so traumatic out there. On the physical, on the mental and social areas, it becomes even more difficult to say now's the time to go in. And I couldn't agree more than to say, guess what? In all those three realms, the physical well-being, the physical health, the mental health, and the social well-being, sooner is better than later. And what does that mean? It doesn't mean necessarily that you have to go to the ER, to a trauma surgeon for a sore throat, right? You determine where do you fit in and who is ultimately there that can give you a hand on this, right? It may be a mentor, right? Because that is, in essence, part of mental health. It's talking with someone. It may be a best friend. It may be a family member. It may be someone at the school. It may be Tracy within behavioral and community health. It may be, our incredible experts at the university, at the health center, right? But the reality is that I think everyone needs to walk away from this today saying, when you feel it's time to talk with somebody, talk with somebody. Right? There's no parameter that says, okay, now you should go in and now it's time to talk with a psychologist, a psychiatrist, because the reality is, yes, Adam was right. If he gets to the point where you're functioning not at the level that you should be, that's a sign. The entry point then needs to be begin talking with somebody. And people will be honest. A friend will be honest saying, hey, Charlie, listen, I appreciate what you're sharing with me, but this is beyond me. You should probably go talk to X. And X may say, ooh, you're getting to places that I don't feel comfortable about either, but I care and love you enough that I want you to go somewhere else. So I think this is a real important aspect that, we still have a stigma. I think, Adam, you've mentioned that it did get better with time. But, I came from a uniformed service background, right? As the acting Surgeon General of the United States, where we told people, mental health is a key part of health. And yet my own service, right? My own service, the Public Health Service Commission Corps, if they knew that you had sought counseling, right, as a student, they would look at you twice before they would commission you into that service, as if this were some sort of extreme abnormality. We have to get out of that zone, right? We have to openly say, I really think talking with somebody is part of my bigger health picture.
And part of that is being able to recognize within yourself that things are not what we're used to, right? And so understanding when in our bodies, in our minds, in our actions, that shift starts to happen. And I think, we are all learning at my age, I am still continuing to learn about my mental health and when it is really starting to suffer, and recognizing and pulling back and taking care of myself. And if we can all start to do that and just become a bit more self-aware of when we're starting to feel the anxiety, when we're pulling away from our friends when we should be moving towards them, we can all start to improve our mental health on a regular basis and just become better advocates for ourselves. And of course, listening to the previous panelists, that stigma is still present. It is getting better, and I'm hoping as more generations come through and become more aware of mental health and are more encouraged to seek the help that they need, that will occur. And as Adam had said, don't wait until it's a problem. It's almost like you go to your primary care physician, you have an annual checkup. You can do that with your mental health as well. It is perfectly acceptable and something we all could benefit from.
But I also want to add another part that I neglected to say, and I think the others would agree. I'd like to hear from Adam and Chetan on this in particular, right? From your clinical aspect is, we're putting some of the burden on ourselves, saying, well, when I'm not sort of feeling that angst, maybe I should talk with somebody. But also, we live in a society, and again, the problem is in the midst of COVID, we're not seeing each other on a regular basis. But what is the responsibility of a friend towards a friend, or a family member towards a friend, saying, hey, listen, Meredith, you're not acting like, is there something wrong, right? Where is that ability to sort of be the entry point of that concerned friend, that concerned family member, the concerned, partner, right? To be able to say, listen, I'm worried about you.
I would agree. I would add to that, we know some aspects about suicide and risk factors for suicide. And one of the risk factors that elevates your risk is being Caucasian. And there's kind of curiosity of what may that come from, but it might be because we in this culture, at least in some communities, have this nuclear family, whereas other cultures around the world have more of an extended family, and which creates more of a support network and system for taking care of one another when you see that they may need it. And this is particularly challenging, like you say, during this time where we're also isolated already, and we're coming up on Thanksgiving and the holidays. We may not see our families, so it's just compounds that potential help, that or compounds the lack of that potential help in many situations now.
I completely agree with what both Adam as well as what Boris said over here, which is the importance of relationships. We live in a highly individualistic culture where the focus is many times on my needs, on the individual all the time. And while certainly that allows for a lot of good things to happen, that can also lead to a lot of isolation, a lot of getting stuck in this kind of a very narrow way of thinking. And the more we are able to, as Boris pointed out, able to actually go out and actually talk to people, communicate with family, friends, etc., etc. Clearly research has shown that social connections are one of the top things that allow for happiness to exist in our lives. When you look at all of the other factors, money, etc., all of those go until a certain level, but it's the social connection that adds richness and happiness to a life. So absolutely agree with what the other
and Micah and Kelly, is this a that you feel comfortable having with your friends? Because again, I'll go into that parameter on the physical, health aspect and the social health aspect. It's almost a natural. Hey, you've been working out or not? You probably should work out. You're gaining a little weight. There may be things like that. Let's go out and do something, etc. Socially, hey, you're going to this party, you're doing that. Is the mental health aspect of discussions with fellow students, is that an open discussion, or is that still sort of behind closed doors, so to speak?
I would say it definitely, I guess anecdotally depends on the friendship and the relationship, but I think increasingly those conversations are becoming more common, but there's definitely a lot of work to do in terms of getting peers comfortable supporting each other and bringing up these questions. Absolutely. It's still definitely, I would say, much scarier and much more stigmatized to bring these things up than it is to bring up concerns about physical health and things like that.
Yeah, I definitely say we're lucky that it is more of a topic of conversation, but also I think that it's really interesting that if you were talking with your friends about mental health or whatever, or just how's your day, the first answer is stress. And it's something you're anxious about, a test or whatever. And I think also just being on a college campus, like in this culture of like studying from 9 a.m. until 3 a.m., like that invigorates it even more. So I think it's really important to have these like genuine and honest conversations with one another. And it does, like Micah says, depend on your friendship with the person. But I think for the most part, it's a good conversation that people do have.
And going off of what Kelly said about stress, stress is a very common theme in college students, especially during today's world. So I guess, do you have any advice on dealing with the current state of the world in terms of stress or even news overload? Maybe you could touch upon economic stress or graduation in a pandemic, or those who are struggling with social isolation on campus or at home, or meeting new people or meeting new significant others, making relationships. And lastly, a bit ironic, but is Zoom fatigue real, and how should we address it if we need it for classes?
I'll start with the Zoom fatigue piece because I 100% believe in this. I see it in my children. They are in virtual school right now, so they are on their computers from, oh goodness, 8 a.m. until 3 p.m. And they look like, walking zombies at the end of the day because they've just been glued to that screen. Myself as well. I'm often in meetings for 8-9 hours out of the day, talking with folks, teaching in the classroom or in the virtual classroom, and have had to develop some strategies to reduce the headaches that come along with it, the sheer exhaustion of looking at a screen. And so I think for some just very subtle tips, get away from the screen as much as you can. When you have that time between classes, break your eyes away. Try not to check your email at that time if you can, or do a little work. Go outside, get some fresh air. I was talking on a meeting just a few hours ago with someone who had not been outside in 3 days, and I was just floored because today it rained, so probably not a great day, but you've got to get outside and breathe some different air. Take a different perspective. It can help your body relax and help your mind relax. It also can do wonders for your mental health. I think thinking about Zoom fatigue as well, stand up. I am no stranger to being in a meeting and I'll just stand up. It changes the whole perspective. You can tilt your screen, make it that you're still engaged and paying attention. But getting that, again, the blood flowing, I think can be really useful as well, especially if you have back-to-back classes, alternating which ones you're standing, or taking a 10-minute standing break halfway through can be really helpful. I think one of the key components of Zoom fatigue is this challenge of we don't get to see each other's communication, right? And so we're on these Zoom calls, and sometimes in a classroom, you're teaching to a bunch of black boxes. Other times, everyone has their cameras on and you can see them shaking their heads, but it takes a lot more effort to do that. We're missing out on a lot of those cues, which is exhausting because we're constantly trying to figure out what was, and Kelly, I mean nothing by this, what was Kelly's tone by what she just said? What was she trying to convey there? And that in itself is exhausting, coupled with, I think, the fact that, I'm staring at myself right now in addition to all of you. And that can be exhausting as well because it's putting an added stress on your self-image and the things that you might critique about yourself. And so turning off your self-view can be another way to battle that. So those are just a few things that I've tried to put into our lives here as we're constantly on our computers all day long as well.
This is not a clinically studied thing. I don't know, maybe it is, but I can tell you, just personally, I had been watching the news like constantly, and just anxious. And I skipped it for like 4 days, and I was just surprised at how relaxed I felt. I mean, relatively speaking, so I'm not sure if that's like a something that's written down as a tip to do, but it certainly helped me, I think, to tune out just occasionally. And you talk about being at home and working at home, school at home, home at home, like what separates it all. And I think it's really important. I found a way to do it with an app, but I mean, there's a lot of ways of really trying to create a time when you're working or doing school or whatever, but then separating that from, like, now I'm home and I'm going to be in my home kind of mode, because otherwise it can just all mesh together, and you kind of lose that perspective or something. So turn off occasionally is what I would say.
And I would agree with that. A couple of things that I have noticed that I've been talking about since this COVID-19, since the pandemic started is, what we are living through is in so many ways so unusual, and we are having to relearn behavior. We are having to learn new behaviors in order to adapt to the changes that the pandemic has caused in our life. So the things that we used to do naturally before, automatically, like in between classes, go hang out with friends outside, or just call pick up the phone, call someone and say, do you want to go out to dinner? Those things are not happening that automatically, naturally, as they used to happen in the pre-COVID era, in the pre-COVID world. So what I've been stressing the importance of on a consistent basis is we need to be in what is needed now more so than ever is an intentional focus on how we can how we can keep self-care related stuff at the forefront of our minds, and then actually developing behaviors to be able to then take care of ourselves. So for example, as Adam mentioned, or as Tracy mentioned, right, being able to disconnect, that is an intentional behavior. I mean, we are living in a world where there is so much anxiety and so much stress that's all around us all the time. And if you're constantly connected to media, it's going to create anxiety. So then intentionally you need to create this behavior that allows you to disconnect and do something else. So intentionality, to the extent that it's possible, is really, really important over here. I'm also a big, one of my areas of interest is interpersonal neurobiology. And Dan Siegel, some of you might know about him, has put out this several years ago, put out this thing called as a healthy mind platter. And I'm going to leave the link for it over here. I try to follow it every day as it gets towards, what your brain needs on a daily basis in order to function well. And again, intentional attention to those things is going to be important.
I think part of the key feature, and I think everybody has sort of said about this, is the idea of part of de-stressing is finding what formula works for you, what healthy formula works for you, right? I mean, the issue of de-stressing and going down negative routes, right? Substance abuse. Oh, I feel really distressed when I have a couple of drinks in me, right? No, that's not a good behavior, right? Or if I get myself on some pharmaceutical agent, no, that's not a good thing. It's mixing it up so that you get yourself to a level of comfort. And the key is mixing it up. The key is that part of induction of stress is what? Is the repetition of things that lead towards unknown goals in front of you, right? And I think that that's a major, aspect of each of us on an individual basis will have to figure out what may be our own formula that allows us to go there, right? Some people use the techniques of mindfulness, right? Not thinking about worry, not thinking about guilt, not looking forward, not looking backward. It's the here and now. It's the connectivity with the joys that are happening right now. And in essence, I'll tell you a personal experience, right? I had it all figured out. I've been doing pretty well, right, in the midst of all this. I'm dean, I'm running a school of public health. I'm got used to the Zoom meetings, but I'm mixing it up because what can I do? Every day, whether when my kids were home, they're college age students, right? In the brunt of the pandemic, it'd be the four of us, my wife and the two kids. Then it would be my wife and I, it'd be going out and taking walks through the neighborhood, right? It'd be as simple as that, right? Usually as a family unit, often as a couple, very rarely alone. But even on that time span, it was a time to break away. And my curveball is, and I'll bring in the personal side of this, 7 days ago, I had foot surgery. And now I'm living with this, right? We're living with this in the midst of all this. And where I thought I had it figured out, I'm now finding 7 days in, I am really stressed by this, right? Because my usual mechanisms that I had the formula of saying, Boris, this works for you, is now, at least for the next 4 weeks, that I'm not allowed to do weight bearing, and it's driving me insane and batty, is I got to figure out a new approach, don't I, right? And to me, it's like I'm really sort of hit, kind of for a loop here, right? Which is, and yet it's part of it is my responsibility, right? Figuring it out. Part of it is my loved one, my wife in my house, who's now my caretaker, bringing me food on a tray, helping me out, right? There's transitions that are going on that are both stress inducing and depression inducing, right? There is this melancholia when all of a sudden you're not allowed to do the stuff that brings you joy. So you have to figure it out, right? It's again, a part of the metamorphosis.
Oh, sorry, Kelly, go ahead.
I just wanted to add off of what Dean Lushniak was saying about trying what works for you. A personal experience, I've read so many different articles about how to be in touch with all 8 dimensions of your wellness. And I thought that if I could do yoga, then I would really be happy and stress-free and everything. And that just wasn't my cup of tea. And that doesn't mean that there isn't a cup of tea for me. I found out that my cup of tea was calling my parents, my family members, and my friends, and just talking to them and having that connection with people. Also, Dr. Joshi, I totally understand the intentionality between all of your different activities in daily life. Walking to class every day to the School of Public Health, it would be at least a mile from my apartment. So when I would walk to class and walk home, I would clock in around 3 or 4 miles a day. Some days at home, I'll clock in half a mile, which is pretty pathetic, but that just shows that I do have to plan in those extra 10 minutes to walk around the apartment or go outside or whatever.
One additional thing that I'd like to add to what has already been said is, every year the counseling center runs a census for students, for incoming students. So we did the same thing this year as well, and we got responses from about 4,000 students, and did some research on them. And what we have seen, and we asked specific questions about the pandemic and how it's impacted mental health. And what our research has shown us is that certain coping strategies work significantly better than other coping strategies. So I'll name some of the ones that the report states. So coping strategies such as seeking social support from others, family, friends, active coping or planning, which is again the intentionality piece, acceptance, self-care, positive reframing of what's going on around us, religious or spiritual coping, and then altruism, being focused on others, helping others in need. When we did research on all of the responses, we found that incoming students who engage in these coping strategies were faring much better overall in terms of their mental health as compared to students, which goes back to what Boris said, who were engaging in coping strategies such as using substances or using coping strategies that involved avoidance, denial, or disengagement from what is going on around us. So just wanted to kind of put that out there.
I'll just add really quickly, expanding on the intentionality component that Chayton and Kelly addressed. I think when we are wanting to change our behaviors, it's really easy to look at it as I want to do less of something. And I think if you can instead identify what you'd like to do instead and conceptualize it as, so rather than I want to go on my phone less between classes, you can think of it as I now go on walks between classes. So if you intentionally decide what behavior would get you closer to the state of mental health and well-being that you want to be in, and then view yourself as just pursuing those goals, I think that can be a really helpful way to make things more manageable and more motivating.
All right, thank you. It looks like we have a few questions from the participants. So Jessica, could you ask your question?
Yeah, so recently around the start of the semester, I started doing some teletherapy with my therapist, and I was just wondering, how do you guys recommend college students who want therapy to seek that out, whether it's through a friend or an actual counselor during the COVID pandemic?
The good thing over here is the primary mental health resources on our campus, which is the counseling center and the behavioral health services, we worked really hard to quickly transition all of our services from being in person to to this teletherapy services mode. So at this point, and I've been saying this over and over again, and I want to say it as many times as is needed. We are here. All you need to do is, if you feel like you need support, pick up the phone and call us, and we'll go ahead and get you connected and engaged in the teletherapy services that we have. And we have the full range. We have individual therapy, we have group therapy, we have online workshops that are being well attended. We are able to provide consultation, on-call services. In Adam's case at BHS, psychiatry services. So all of these services are available to all of you. Again, just pick up the phone. We'll help you get connected.
And just, I would add, that I mean, we've kind of in a good way, in many respects, been kind of thrust into the telehealth world, and it's given us kind of a rapid, kind of a trial run. But the research that has been done, at least with psychiatry, and Chethan, you can speak to the psychology research, but that there's really the quality, the outcomes are the same. They seem to be the same. There's no decrease in the quality of care when you receive treatment through telehealth, telepsych. So that's great, like that we've learned that. And so I think a lot of people also find it very convenient, and there's a lot of opportunity to use it. So I think that's kind of one of the silver linings of this, if we have one, that we've kind of been, able to do that so quickly. We still have challenges with respect to, I think there's a question about it, like across state lines, treating across state lines and whatnot. But I think we're moving as a country in a direction where this can become, we can use this to our advantage in many ways.
All right, thank you. And Miriam, I saw you had a hand up. Do you have a question?
Hi. Okay. I have like a comment and a question. Is that okay?
Yeah.
Okay. So they're not really related, but like, okay, so I have like a point of discussion. And so that was basically like a while ago, someone was saying how like, people of color have like a lower rate of mental health issues. I just wanted to say like that's like a really like I guess it's like an interesting point to consider because in like from my experience as a woman of color, I honestly think that like first of all, it's severely underreported how many like non-white people have mental health issues. And I think there's a lot of stigma, not just from within our non-white communities, but also from outsiders who think like that there's something different about us. So like, for example, if you look at the news and you see like a brown person committing some kind of horrible attack on people, then they're labeled as a terrorist. But if you see someone else doing that and they're not brown, then they're labeled as like mentally unstable. So there's like all these different perceptions about mental health, both within and with like outside of those communities. And in addition, like there's this expectation, at least from my point of view, to always be fine. And I know somebody mentioned, the person who was talking about that mentioned like the familial aspect being helpful, but I also think I think that the point is valid where like Americans really value individualism, but at the same time, like sometimes you need that individualism to advocate for yourself, because in communities where like family is valued too much, then it's seen as like selfish if you're trying to advocate for your own needs. So there's like that. I don't know, I felt really strongly about this. So I just want to bring it up and just hear what you guys thought about it. And then another question I have, the question is, how can we, so I'm an out-of-state student and I have tried to get help before at the counseling center, but they like, because I'm out of state, there's like legal guidelines that prevent me from like joining online support groups and even like being able to talk to a counselor a little more regularly. So what are resources for out-of-state students?
Sure. So I can speak to the second part of your question, Miriam, and then I'll leave it up to the other panelists too, and I can certainly add into the first part as well. So specifically about the out-of-state student issue. This has been since the pandemic started. This has been an issue that has been there and is persistent and has not been addressed in any kind of a good way. So the problem over here is each state has laws that govern the practice of psychology across state lines. Since the pandemic, there's been multiple legislations that have been thought of or have made some progress to figure out ways in which those laws can be relaxed so as to allow psychologists to be able to practice across state lines. But if you look at there's one document that currently exists that lists all of the different laws across all of the states guiding all of these different disciplines. If you look at the laws and the regulations, it is such a horrid mishmash of things that it's really hard to figure. It's been really hard to say, okay, for someone in Delaware, you can do it in this particular way. Versus someone who is in California, you need to fill out an application and you'll get your license in 90 days, and then you can do something. So it is this incredible mess of laws, which has really prevented which has really impacted our ability to be able to provide the full range of services to out-of-state students. So what my recommendation and what we have set up at the counseling center is, if you're an out-of-state student, what you should do is pick up the phone, call us. Our triage clinicians are set up so that they'll be able to quickly assess what's going on with you and then actually work with your family if needed to go ahead and help facilitate a referral to a provider in your community, either by working with your insurance or what have you. So that is currently what we are able to do, and we are constantly monitoring the situation to see if there is any kind of a national level law that passes that will allow us to change in the direction that allows us to provide the therapy that our out-of-state students need.
Yeah, I'll add to that, and then I'll get to the first part of your question or comment. So as a psychiatrist, and I'm still learning, within the specialties of medicine, there are some subtle differences, but as a psychiatrist, I have to be licensed in the state where the patient is located. And so that presents an issue of, if I'm in Maryland and I have a license in Maryland, what do I do with my patients who might be out of state for living with their parents right now? The good news is, because of the pandemic and the relaxation of the laws, and it's still complicated, like Chetan was saying, every state kind of interpreted that differently for their own state. But there's a movement now that is gaining momentum to try to have it, change so that it doesn't matter what state you're in. Kind of like a driver's license. Like we get a driver's license in Maryland, but it doesn't mean we can't drive to, Pennsylvania if we want to. So we'll see. I think that might be the silver lining, but currently it's frustrating. And so we're trying to find ways to help the out-of-state people find what they need. I don't know if you were referring to my comment about suicide and the elevated risk in Caucasians. Okay, so yeah, that's specific to suicide and the risk factors, like the demographic risk factors: elderly, male, prior history of suicide attempts, Caucasian, and we still don't know exactly why that elevates your risk. One of the theories is because of this nuclear family that sometimes in those populations tend to limit, the access to help by family. But trust me, my dad's side, they're Persian. It's an extended family. They sometimes can be overbearing, and so I didn't mean to suggest. I get that too. Like, it's not a one size kind of fits all. And so the difference in suicide is what I was talking about, and just that particular risk factor. Chetan, you said you had something to add as well.
Sorry. No, that was the main thing that I wanted to say. Mariam, actually, Adam, thank you for reminding me. You're absolutely right. The stigma, as much as there has been a stigma reduction in the in the majority culture, we consistently see that students from minority groups do experience a lot of mental health issues, and there is still a lot of stigma that gets in the way of them seeking out the help that they need. And what we have found, and what Adam and I have been working on in terms of developing a mental health proposal, is ways in which we can actually go out and reach out we're already doing that in some ways, but even more so, of reaching out to students from minority cultures by being present in their environments to be able to build a bridge that they can trust to be able to cross when they need the help. So that is some of the current stuff that we are working on.
And I think, Miriam, it's a very good, observation from you. I think, several points that you hit upon, which actually bring up the sort of the public health aspects of this, the epidemiology, right, and the surveillance of this, which is one, underreporting as a major scheme, right, where we still have a taboo society that says, oh, no, don't go in with these problems. So the question is, what is reality when people are not necessarily coming either to the clinician or going elsewhere for counseling, and how is that being tabulated? The issue of privacy issues built into data sets like that. And then finally is the issue, and I'll sort of put it on our clinical behavioral experts here, which is the difficulty of diagnosis, of exact diagnosis, right? I mean, this is part of the dilemma is, if we, as from the epidemiological world, you want to have a case definition, right? You want to know, what does that case of COVID mean? How do you define it so that you can count it appropriately? And therefore, it's not numbers. What do you learn from it? Who is at higher risk and all? And I think part of the issue is going to be sort of the diagnostic criteria and the difficulty oftentimes of diagnosing appropriately, right? These are all evolving aspects of the epidemiology of mental health disorders.
Yeah, we don't have a blood test for depression. We don't have, like other specialties in medicine. These things are sometimes arbitrarily, create or devised, and so it's very complicated.
Thank you. And the next question from Gabrielle.
Yes. Hi, everyone. My name's Gabby. So first off, I just want to thank all of our panelists for being here today. This is such a wildly important and relevant issue right now, and I'm just very grateful that you've all taken the time to be here and just speak with us and speak one-on-one. That means a lot. So for my question, for those of you who don't know me, I'm a senior, I'm a criminal justice major, and my particular interests are the development of mental health over the lifespan, particularly, and how it changes over the course of your entire life. And earlier in our discussion, you guys had touched on the importance of going out and seeking connections and fostering connections and picking up the phone and just being comfortable speaking to people, which is so important. And I was wondering if in each of your respective roles on campuses, on our campus, if you found that age has an effect on someone's willingness to foster these connections. Or for example, for myself, I feel that like I deal with my own like mental health issues, and I think I'm 21 and barely an adult, but I think right now I have I find myself questioning, like, should I really go out and seek help right now? Like, I'm an adult and adults should be able to handle it themselves. And I was wondering if you guys found that even between freshmen versus seniors on our campus, if that's something that changes with age, that willingness to seek help and seek resources on our campus.
I can speak to this purely from an academic standpoint, having taught across the 4-ish years that students are in our program. I do notice that first-year students tend to be a little more hesitant about coming forward if they're struggling with issues. And it gets a little better as students go through their programs and they mature and they understand that we are here to help them. And I think from the academic side also, it depends on the faculty member and the support that's given within the department via advising, whatever it may be. And if the perception is, and something we pride ourselves in the School of Public Health, in Department of Behavioral and Community Health, is that we are there for our students. Students are our priority, And we want to make sure that they are getting the assistance that they need throughout their program, so that way they can be as successful as they can. And what I see is, as students get into their senior year, the course that I teach now is for those students. They are much more willing to come forward. You know, it's within the first 2 weeks of the semester, I'm having them in my office and we're chatting about how their lives might impact their ability to search for their full-time internship that they have to go through, how their anxiety might impact their ability to interview with somebody, and things of that nature. So I do see it change over the course of time in terms of seeking out academic assistance and academic resources.
You know, in the bigger picture, Gabby, I'm almost wondering, and you know, we can sort of make a full discussion even out of this, is that, you know, I talked a little bit about the generational perceptions of mental health and the idea of, you know, do you seek help or not? You know, I would say, you know, I'm 61 now, so I'm a whole different generation. And in our generation, it was exactly that. I think the attitudes were, you tough it out, right? I mean, it's a sign of weakness to have a mental health issue, right? To even admit to it and to seek counseling on that aspect, right? And my hope is that that is soon to pass on, right, as generational shift, because I think the more modern approach is going back to that definition of health that I shared with you, right? Which is, this is an important component. This isn't optional, nor is a sign of weakness, nor is it a sign of you know, of not being able to handle it as an adult, tough it out. But in essence is, and again, the challenge for us is to really strongly believe in this, that this is a key component of our health, right? That the mental health, the social health, and the idea of physical health is all a combo. And one is then affected by the others, right? So you can't say, oh, I'm an incredible physical specimen, look at me, when in fact I'm hit with depression or anxiety, right? It's not a match. So I would say from a generational aspect, and again, you know, I'll leave our clinical side of the house to say, you know, from Adam's perspective, right? Is it more of a problem seeing, you know, do you see fewer adults coming to you or not? Again, part of it is, you know, every individual handles things differently in terms of support mechanisms and all. But I would hope that the perception of this issue, right, is changing, and that your generation in particular will, to some extent, make it more acceptable that, one, people like Tracy and Shaitan and Adam truly care about the mental health of our community, right? That's not only their job, but they believe in it. And that you need to be empowered with the idea that you also need to believe in it and to take care of it.
All right. We have a question submitted to our forum. It's how can we advocate for our own mental health? And alongside that, could you also mention how receiving therapy, what are the options available at Maryland, and how it works with insurance and parent notification?
Well, I'll start. I know we both the Counseling Center and the University Health Center, Behavioral Health Services, we both offer therapy. And so, you know, we don't bill insurance. And in terms of the number of the visits, you know, it's hard to kind of pinpoint a specific, or, you know, have a number exactly. I think the focus is more on, it is short term. But again, we have people who sometimes need a little bit more, and we try to accommodate that. Generally speaking, it is meant to be short term. And I think you know, Chaitan can share what he has with respect to the Counseling Center side.
Right, absolutely. At the Counseling Center, to short to medium term therapy, usually that translates to about 8 to 12 sessions. What we find on a regular basis when we look at our statistics is that students come in for an average of about 5 or 6 sessions. And then once they come in, have had their 5 or 6 sessions, whatever the presenting issue tends to be at a place where they're feeling better or has been addressed. as Adam mentioned, we do not bill insurance. All of the services that the counseling services provides are completely free, and can be accessed by calling our main counseling center number, which is 301-314-7651.
Yeah, and I just forgot to add too, I don't know if it was part of the question, but and you know this already, but we also have psychiatrists and psychiatric nurse practitioners at the health center, and often our therapists work with students who are also receiving medication, and sometimes there's there's a collaborative approach with respect to the psychiatrists and the therapists working with students in that way.
Yeah, thank you. And another question, maybe this could be more towards the students. With online schooling, how do you think you can help people from feeling lonely and depressed about life to feeling connected and optimistic about the future? The world has honestly been reduced to my room and the 5 miles it takes to drive to the grocery store.
So I know that's something that I personally do struggle with. There are definitely times when I do feel very trapped in my room, like it's just kind of a box that I'm in. But also some ways for me to stay connected with society and everything is, first of all, I definitely try to stay off of social media because that makes me more disconnected from my peers in society. But I do like to call people all the time. I put in my Google Calendar to call people at random times, even for 15 minutes. And I know that sounds silly, but it just does remind me to make sure that you could check in with people. And additionally, a thing that I've been doing is going on walks around campus and seeing people on the Keldon Mall playing Frisbee or playing soccer and having masks on, and just things like that help to make this still feel like a community, that we're all in this together.
Yeah, I would echo making time to reach out to your friends and your family, even if you have to do so over technology, and definitely making time to leave your apartment. I think, kind of like I mentioned earlier, making it a structured part of your day. That's just something that you do. Also, I know walking around on campus can even be a little bit limiting, and it's hard sometimes to avoid being really close to other people, and it can be hard to walk around with a mask when you get out of breath and things like that. So just a reminder that places like parks are also open at Lake Artemisia. I go there every day that I can and walk like 5 miles, and it's like a really big part of my daily routine that I love. So I would definitely recommend, maybe I'll see some of you there sometime. I think it's a really healthy outlet and way to make sure that you get out of your space, because it's really important that you do change up where you are throughout the day.
And if any of the other panelists want to chip in?
Well, let me even, I am going to sort of put a sense of reality also into this, is that this is a critical thing to be discussing, right? And I'm glad the questions come up. I'm also, the sense is that, this is a struggle for almost everyone. So one aspect of this is realize that whoever asks us that question is, you're not alone at this, right? Even though you may not feel connected with others, almost everybody is going through this sense of like the leash, right? Where is my leash allowing me to go? But this is critical to come up with that answer. And again, whether it's sort of the Kelly Sherman aspect of making that phone call and connecting. It's Micah's example of going to Lake Artemisia, which, by the way, I also love. It became my major running route last year, off campus. But it's the sense is, you have to really work hard and figure it out, because I'm going to put in that sense of reality, right? This pandemic is not over. We are not rounding the curve on this, right? And again, I'm being nonpartisan. I'm just telling you. The sense is, look at the numbers today, look at the numbers yesterday. We are being warned that, it's going to get worse before it gets better, which means that the end is still not in sight, right? We can hope for an efficacious and safe vaccine at some point, but chances are next semester is going to be more like this semester than it was last year. I also have the optimism that next summer is not going to be like last summer. We have learned things in this there has been progress in this whole thing. So you got to go in optimistically to realistically. It's not going to end like that. which means we have to figure out what is our coping mechanism for this sense of confinement. And again, my goal is mix it up, right? Because what worked 2 weeks ago may not be working now, right? So the idea of variety as the space of life is part of the answer on all of it. But I think this is really critical to continue this conversation. And also, this is a beautiful opportunity for us to share, right? Part of this is talking with friends, saying, so what are you doing, right? What are you doing? How are you, and again, nothing is applicable across the board, right? What works for Micah may not work for Kelly, may not work for Gabby, right? Or Jessica or Miriam. That's the people I see on the screen right now. But the reality is that talk with people so that you know what the options are and experiment with that, right? Experiment with that, because you're going to be, the beauty of this pandemic and the crisis that we have come through is if you're not learning about yourself in the midst of this, if you're not changing a world perspective, then you're not paying attention. So I would appeal to you, use this as a form of your life story, right? None of us chose this to happen. We did not want this to happen. No one did. It happened. So the question is, how do we turn out at the end of this better than who we were going into this? And we're in control of that. And part of that is, are we looking the wide angle view on this? Are we learning about society, about racism, about things like that? And are we ready to be activists and advocates after this? This is what inspires. Crisis inspires people.
Yeah, thank you. And for the next question, we briefly touched on it earlier, it's sleep. So how important is sleep for health? Since a lot of college students are staying up until 2, 3 a.m. trying to finish their exams and end up drinking coffee instead.
I'll take this one. I love this topic. Sleep is key. Like, it is so important. I cannot say that enough. And I guess I will continue to say this. People have heard me say this before, and I don't use the word literally when I don't mean the literally. I literally talk about sleep with every single patient I have. Sleep is so connected to mood and anxiety. And if you're not getting 8 to 10 hours of sleep every night, it's going to impact your mood and your ability to get treated and feel better. So, sleep hygiene is one of the most important things I think that people can do to help themselves. Going to bed at the same time every night, waking up at the same time every morning, using your bed primarily for sleep. The goal is to associate the bed with sleep. So when your eyes see the bed, your mind thinks of sleep. No screens, and if you can't sleep, don't toss and turn and stay in the bed. Get up and do something boring, not getting on social media or anything like that. But I tell people to read the warranty on their refrigerator, something that's going to make you tired, that's boring, and then you go back to the bed. Because the longer you stay in the bed and toss and turn and not sleep, that associates the bed with not sleeping. So you'd be surprised at how much sleep can make anxiety and depression better. So there's one thing that I've noticed since I started this job, because I used to be on call a lot and not sleep a lot. And I think even with another silver lining maybe about telework and Zoom is that it does allow you to sleep a little bit more potentially. So getting good quality sleep I cannot say how important it is. I can't say that enough. So that's my take on sleep.
Critical from my perspective. And you mentioned the idea of being on call. So let's not only talk about this idea of how it is, it's better for your health overall to get those hours of sleep in, but it's also a performance issue, right? Pulling an all-nighter, actually, you may feel like, oh my God, I really needed to do this. Yet, there are studies that say your performance actually is affected by that. In the medical setting where we used to be, when I was training as a physician, the idea of being every third or fourth night on call, and you were up all night and then worked the full shift taking care of patients later, has been proven to be associated with errors done on in the world of medical practice. So much so that we've actually had a major shift in medical training, where now residents who are still having to learn, right, to take care of patients are now limited with the number of hours they can work per week, right? We had to put in this sense of a guardrail, if you will. Realize that your performance as a student is directly affected by that. And I know, again, the stressor is, oh my God, I'm really far behind. Figure it out, but try to make that aspect of your sleep just as critical as studying to a large extent, because the performance aspect will be there, right? You'll see profit from that.
You know, that change in the law, at least for residents, happened the year after I left residency, so I missed it by just a year.
Kelly and Micah, could you also talk about sleep, since you guys are students or going through this?
Micah, if you want to go first, I'm probably the unconventional answer on this.
I would also consider, I guess I'm conventional in my needs, but unconventional in how much I prioritize it. So I really need 8 hours a day to function properly, and I'm actually pretty good about getting it. And I don't know what advice I would give to people who are struggling. I guess kind of following the same line of advice that I was providing before. I think that instead of thinking to yourself, I need to stop staying up this late, just decide what's your new bedtime, what's your new wake up time, and try to stick to that, because I definitely have experienced firsthand the importance of how much it impacts my mental health, my ability to complete my schoolwork, how much time I can devote to extracurriculars, and even how much effort I can put into my relationships, which, as we talked about, all of those things are really important for our wellness right now and always. Kelly, do you want to share your situation?
Oh yes, I'm a solid 8 hours a night person. And as one of those, I think one of the biggest things that was instilled in me at like a younger age was just like, don't let school get in the way of your education. And school is always going to be there. And I think there are lots of stressors and everything. And just from reading studies about how cramming doesn't help you, I have pulled a few all-nighters, but also on the tests that I do the best on, they're the ones that I got a full night's sleep before and had breakfast in the morning. Even if I was unsure about one chapter at the end, I still aced the first 90% of the test, which is kind of what I would say to different students going through this. And then to help with actually sleeping, I have an iPhone and I use the bedtime feature. So about 30 minutes before I'm supposed to go to bed, it sends me a notification, which sometimes I listen to and sometimes I just miss, but it basically tells you to turn off your phone, wind down, like whatever, get ready to go to bed. And I think that's really important to like just regulate that schedule. Even if it's my phone telling me what to do, it's still something to hold me accountable.
Thank you. And pivoting a little bit, as we know, the election is happening next week, and a lot of people are stressed about the election as it's happening. Are there any resources from the counseling center, the health center, or even the academic colleges to support students as they go through this time, when a lot of them are voting for the first time?
You know, so we had the election portal, and so there's a lot of good resources put on there by experts across the university. Specifically, as far as BHS and the counseling center is concerned, we have worked on creating a tip sheet for how to manage your stress in the pre-election world, on the day of election, and post-election. Vice President Patty Perillo will be sending it out shortly, along with an email from us. So that should be, you should have that in a day or two. And then it'll also probably be hosted on that website, the election portal that I talked about.
Yeah, I think, again, from the academic sense, you know, the deans and the provost and the President Pines, we've been talking a whole lot about this, as has, you know, at the cabinet level, Patty Perillo and student affairs, that, you know, There is a worry because of, everybody knows it, right? This has been one of the most difficult election or campaign seasons that we've ever seen, on top of everything else going on. I view it, and I actually today I was penning my message to the students at the School of Public Health, and I reflected on my own personal story. So I'm the son of immigrants to this country. So I grew up as in the Ukrainian neighborhood in Chicago, and as I wrote this, I was remembering how, as a little kid, my immigrant parents who were recently became citizens of the United States proudly went to the voting booth. And there was this whole ritual, right, where it was a big machine, and I would go in with my mom, and I'd go in with my dad, and there'd be this lever, and it would close a curtain, and then they would have to sort of put down these notches for the candidates. And afterwards, there was a final move. And I remember what time they let me do the final move, which is, I was pleading, let me do it. And you grab this big handle, and it took a lot of strength, and you moved it from one side to the other. And it did several things simultaneously. It counted your vote, it put the latches back to a non-choice, and it opened up the curtain. It was magical, but it took a big effort. And as I was I like thinking in metaphors a lot. And as I was putting the message out to the students, I said, part of it is, first of all, be part of the process. So do vote, right? It's tough doing that lever thing, right? And metaphorically, but go and do it, because part of it is you want to be part of the process. You don't want to be a bystander. And I think psychologically, that's a big help, which is I at least did something, right? I used my right, my privilege, whatever you want to call it. The next aspect is, despite all sort of the warnings that this is, again, I'm nonpartisan in this viewpoint here today, but, there's very much a whole lot of differences that are being proposed in front of us. At the end of all this, traditionally, there have always been winners and losers. Maybe it'll take us a little longer, maybe it'll be a little bit uglier, but at the end, you have to have a strength or a belief in the system. The winners claim victory, the losers at some point concede. We have a system that doesn't collapse, right? It's a system with a legislative body and the judicial branch and all that. And I want to de-stress this idea ultimately of what the results are. Be part of the process, right? And then we'll figure it out. It's atypical. I've never been through a campaign like this before. Those of us who are older would have to think back to the year 2000, where we had to wait until the end of December. And that was a novelty for us. Those of you old enough will remember that was disconcerting, because we all grew up saying, by the morning after, we know who takes over, right? Back in 2000, right? Shetan, you remember this probably. It's Adam, I don't know how old you are, but the reality was that was disconcerting, and we thought the world was ending back in that point. It was like, how can this be? And it ended up in the Supreme Court, and it ended up being one state. And at the end of that, guess what happened? The winner took the win, the loser conceded and said, I'm leaving now, right? Again, I gotta fill you with some sense of optimism, right? And we have to be careful falling down the trap of perhaps too much news, too much negativism in the world. And the sense is we are in control, right? We may feel we're not in control, but be part of the process. That's your first step in feeling in control in the midst of this strange election season.
All right, and I think it's getting close to 8:30. So as for the last discussion idea, if all the panelists could just talk about different resources that they have available, or different ways for students to get involved with improving mental health, or for outreach to other students. Could you touch upon those?
Sure. One of the things that the counseling center has, one of the things that we're currently working on is there's two ways in which we have welcomed student engagement with all of the work that we do. So if you're a student who is very passionate about mental health issues on our campus, please, we have a mental health student advisory board that works with the counselings. Gabriel is clapping. Is a part of that board, and so is Josh. So visit our website, get more information about the board, join the board. We love working with the Mental Health Student Advisory Board. Similarly, we are also currently working on building a mental health coalition across the campus, which includes a lot of different offices plus a lot of different student organizations. And the goal of that coalition is to come together to host one or two big programs for greater collective impact, much more coordinated messaging around wellness and mental health. And we are all in the process of kind of figuring out what the coalition is going to do. So if you're someone that's excited about that, we welcome you. Just contact us and we'll be happy to get you included in that as well. And then all of the counseling centers resources can be found on our website. Feel free to visit. If there's any questions, call us. Happy to answer any questions that you may have.
Yeah, I mean, pretty much similar for the health center. Coalition is very interesting, and I think it's going to be a really neat thing. We offer a full range of psychiatric therapy, other services. We're working really in coordination. We're trying to moving forward with the counseling center to kind of get these all more collaboratively based. And so we also have a website. You can check it out. You can always feel free to contact me. Also, I'm very open to that.
In addition to what Shaitan and Adam just mentioned, I think within the University Health Center, a wonderful way to get involved is with the peer education programs. There are several programs that are going out and educating students on these very issues and beyond. And it's not only a great way to get professional experience, but it's also a way to do some self-reflecting, learn yourself, and teach others at the same time. I've gone through those programs. I've mentored students through those programs, and they are just phenomenal. Additionally, get involved within your academic units. I think that faculty want to hear the issues that students are experiencing. Folks in my position, for instance, as an undergraduate studies program director, we want to know what is happening, what your lives are like, and how we can help. And if there are ways that our programs can help minimize any anxiety as much as possible, we are always open to hearing about that. And so any way that you can get involved within your academic units, please do. There are always sounding boards, student advisory boards that need those volunteers.
I'm also about to drop Help Center's information in the chat, which is a peer counseling and crisis intervention hotline. It's a resource that anyone can call, and if they just need someone to talk to, no issues too big or too small, but it's also totally student run. So if you're interested in becoming a peer counselor, we'll be recruiting again next spring. So definitely keep an eye out for that next semester if you're looking to get involved in supporting peers who are dealing with mental health challenges.
And the Student Health Advisory Committee, we're made up of a bunch of different subcommittees. So we actually have a mental health subcommittee. And last week we had a social and academic study hall over Zoom. So you could have joined for that. And they're always planning new initiatives. And every last Wednesday of the month, we have an open meeting. So if you have any ideas or anything that you think that you want to change in regards to your health or experience at the health center, please feel free to come. And I'm going to drop our website and contact information in the chat.
All right. I want to once again thank all our wonderful panelists for coming today and speaking on the topic of mental health. And as we close, I would like to thank our co-sponsors, Order of Omega, Charles R. Drew Pre-Health Society, American Medical Student Association, and the Panhellenic Association. And lastly, another way to get involved is through the SGA's Committee on Health and Wellness. I'll put the interest form for the committee here, and we are the ones that helped organize this meeting. But this is all on the panelists. Thank you so much for your time, and have a good night.
Thank you very much. Very nice to be here with you guys.
Yes, thank you all.
Thank you for organizing it.
Thank you so much.
Okay, how do I stop recording?